Now, what's at stake here is the president's made it clear he wants to get rid of the Affordable Care Act. He's been running on that, he ran on that, and he's been governing on that. He's in the Supreme Court right now trying to get rid of the Affordable Care Act, which will strip 20 million people from having insurance, health insurance now, if it goes into court. And the justice, and I have nothing, I'm not opposed to the justice, she seems like a very fine person. But she's written before she went on the bench, which is her right, that she thinks that the Affordable Care Act is not constitutional. The other thing that's on the court, and if it's struck down, what happens? Women's rights are fundamentally changed. Once again, a woman could be pay more money because she has a pre-existing condition of pregnancy. They were able to charge a woman more for the same exact procedure a man gets. And that ended when we, in fact, passed the Affordable Care Act. And there's 100 million people who have pre-existing conditions, and they'll be taken away as well. Those pre-existing conditions, the insurance companies are going to love this. And so it's just not appropriate to do this before this election. If he wins the election and the Senate is Democrat or Republican, then he goes forward. If not, we should wait until February.
All right.
There aren't 100 million people with pre-existing conditions. As far as the say is concerned, the people already had their say. Okay, Justice Ginsburg said very powerfully, very strongly, at some point, 10 years ago or so, she said a president and the Senate is elected for a period of time, but a president's elected for 4 years. We're not elected for 3 years. I'm not elected for 3 years. So we have the Senate, we have a president.
He's elected to the next
during
election.
that period of time, we have an opening. I'm not elected for 3 years. I'm elected for 4 years. And the 100 million people, Joe, the 100 million people is totally wrong. I don't know where you got that number. The bigger problem that you have is that you're going to extinguish 180 million people with their private health care that they're very happy with.
That's simply not true.
Well, you're certainly going to socialist. You're going to socialist medicine.
We're now into, gentlemen, we're now into open discussion.
Open discussion.
Open discussion. Yes, I agree. Go ahead, Vice President.
Number one, he knows that what I proposed. What I proposed is that we expand Obamacare and we increase it. We do not wipe any, and one of the big debates we had with 23 of my colleagues trying to win the nomination that I won, were saying that Biden wanted to allow people to have private insurance still. They can. They do. They will under my proposal.
It's not what you've said,
But
and it's not what your party has said.
That is simply
your party
a lie.
doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
socialist
right
healthcare.
now, I am
and
the
they're going to dominate
party.
you, Joe. You know that.
I am the Democratic Party right now. The platform of the
Not
Democratic Party
Harris.
is what I, in fact, approved of. What I approved of. Now, here's the deal. The deal is that it's going to wipe out pre-existing conditions. And by the way, the 200,000 people that have died on his watch, how many of those have survived? Well, there's 7 million people that contracted COVID. What does it mean for them going forward if you strike down the Affordable Care Act?
Joe, you've had 308,000 military people dying because you couldn't provide them proper health care in the military. So don't tell me about this.
I'm happy to talk about this.
And if you were here,
Look,
it wouldn't be 200, it would be 2 million people because you were very late on the draw. You didn't want me to ban China, which was heavily infected. You didn't want me to ban
all right, gentlemen,
Europe, which was heavily infected. You would have been much later, Joe.
Mr. President,
much later.
Mr. President.
You're talking about 2 million people.
You're not
Mr. President, as the moderator, we are going to talk about COVID in the next segment.